This is my most requested topic in DMs, male enhancement. And so today we're finally addressing it, joined by Kat Williams, as always. How are you, Kat?
I don't know. I'm here. I'm scared of this topic.
Well, we're going to reveal the one method that can add up to an inch if you need another inch. And if you want to know about it, you got to stick around.
Okay. I mean, I'm not sure where we're headed here.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Today we're covering everything from does size matter, what actually works versus what doesn't work, obviously safety, realistic expectations. So we're going to get a little medical here, but we're also going to have a little fun.
Feels like we're about to get a little dirty.
We're talking about dick size here. I mean, so.
Wow, is that the medical term?
Yeah, 100%.
Wow. Wow. Okay.
All right, Kat, so I'm going to start this off with you.
Great.
Speaking of dick size.
Gosh.
Does penis size really matter to women?
Oh, well, okay. The short answer is yes, but probably not in the way that you think.
All right. Well, please humor me.
Okay.
And remember, I am your husband.
Yeah. Does size matter? I mean, I already need.
I mean, this is going to be very inappropriate.
I already need a timeout.
Yeah.
You have asked me, does size in the male member matter? Yes. But I think there's a bit of a Goldilocks situation.
Expound on that for us.
Well, too small, maybe not the best, and too big also not great. For the guys out there who watch a lot of film where men have extraordinary equipment in the pornographic film, that's not really what most women are A, expecting, B, looking for, or C, want.
Yeah.
There's a happy medium.
I can imagine that, but from the guy's perspective, I've yet to meet a guy who did not want a bigger penis. And as every guy who comes into my office and says, hey, can you make it bigger? I said, listen, dude, if I could reliably do that, I wouldn't be here today. I'd be on a yacht in the Mediterranean.
We'd be on a yacht, yes.
Yeah, the richest man in the world would not be named Elon. It would be Dr. Urologist.
It would be Joe.
Because you'd have a line out the door. But no, I mean, it's interesting because as a urologist, I've seen thousands of more penises than you have. At least I hope so. Going back to secrets from our previous episode.
My God.
And here's the dirty secret, guys. We're all about the same. Like, there's very few guys where I either go, aw, or I go, whoa. Like, that's a rare situation. And just to be clear, that's my inside voice. I would never, of course, judge someone. But for the most part, it's all about the same, and I've also heard this from other women where, guys, not everyone's looking for something with an elbow, like,
oh, we're not,
like we don't want baby arm penis.
Absolutely. Quite the opposite. And is this something that guys really don't understand? I mean, we talk about this.
Not at all.
They're all convinced that every woman is looking for some kind of a crazy porn actor situation. We're not.
Yeah. I mean, if it doesn't have an elbow, it's not big enough. I mean, like, guys.
Okay, you guys need to settle down. Get a hold of yourself. That's not normal, and it's not. It's simply not necessary. And also, it would be a little terrifying.
Well, and I think that's great for guys to hear from.
Do I need to say it
woman.
again?
No, I think we've made that point.
Okay.
So. Let's move on. There's lots of rumors out there about making it bigger, from the magic pills to the pumps to potential surgeries. So why don't we bust some of those big myths around big penises? So,
okay. Wow.
So,
can you make it bigger?
Well, let's get into that. So let's first start with some of the myths, right? So the things that we know don't work. So there's the good old technique of the kind of the self-fluffing sort of thing. If I play with it long enough, it'll get bigger.
Okay, there's another word for that, but
yeah, Jelqing. Yeah, and we had never heard of it before.
Never heard of it.
Jelqing. Yeah, you massage.
Or jerking. Jelqing, jerking.
Clearly, a guy thought of that definition.
You call it.
Right?
You call it what you will.
But point being, you're not gonna make it bigger the more you play with it. I hate to tell you guys, but it's funny. We were joking before we started. Every single time I examine a guy in my office and he drops his drawers after sitting and being in a car, he does the old 1-2.
What's the 1-2?
He's got to like stretch his man out to then kind of stand there in front of me. And it's then followed by a comment of, oh, it's kind of, I wish it wasn't so cold outside.
Oh my goodness. You guys are ridiculous.
And to be honest with you, 99% of the time, the guy's penis is totally fine, normal, and a non-event, but yet again, in our head, we think we're supposed to be, if we're not touching our kneecap, we're not a normal size.
Is this because men watch a lot of porn?
I cannot comment to that.
Okay.
So what are some other things that don't work? There are vacuum erection devices and penile pumps, but to be clear, we don't have any data that they're going to actually make it bigger.
So what do they do?
Well, what they're doing is they're helping guys with erectile dysfunction.
Okay.
Get engorged because you're kind of passively drawing blood into the penis. And then typically for them to be used for activity, they have to have a ring that goes around the base of the penis, usually like an elastic ring. But doing that is not going to, quote, make it bigger over the long term. Now, theoretically, you could stretch your penis enough, and you hear stories of guys like doing weighted things and traction devices. You may make it longer, but you're going to lose some girth. And correct me if I'm wrong from the female perspective. I'll speak from the anatomy perspective. You'd rather have some girth than some length because the vagina's not very deep. It's more the filling of it that would feel good or not feel good. So if you're going to sacrifice girth for length, don't do it. So those things don't work.
Okay. Don't do it. Okay.
Just don't do it. So, what
else doesn't work?
You got the gas station pills, of course, right?
Oh, like when you check out at the 7-Eleven and there's some weird
whatever.
I don't know what these things are, but you see them at the gas station.
Thor's hammer, whatever it's being called these days.
Okay. But this is BS. None of this works.
Again,
God knows what's in it.
If there were a pill that made your penis bigger, we'd put it in water, and guys would not eat food. They would just be walking around with elephant penises all day. So, needless to say,
we would not be happy about that.
No. Well, we'll get into that. Again, let's just humor guys. We want to make it bigger.
Humoring
so
We're humoring.
Those are the things that don't work. So what actually does work? Because there are some medical things.
Okay, well, what does work? And this is to make your penis larger.
So let's first break that down. So the first thing we have are something called fillers, typically hyaluronic acid, very similar to fillers that a lady might use for cosmetic
beautification
purposes on the face.
Okay.
Well, we're going to beautify Mr. Dong. And
Mr. Dong.
What we're going to do is do an injection underneath the skin there. And that's going to be more adding of girth per se. That's not going to necessarily get you more length, but it can get a little bit more full. Now, the problem with any injectable historically is, number one, is it going to get dissolved? Number two, is it going to get infected? Number three, is it going to lead to scar tissue? And so for many, many years, there really wasn't anything reliable. And you hear stories of guys injecting or implanting, stuff underneath the skin there, and you get some pretty horrific cosmetic results. And obviously you get an infection in your penis. That's a bad day.
That sounds pretty rough.
There are some newer injectables on the market. I don't have much experience with them. I think they're just sort of getting going, and some, fellowship trained people are starting to dabble in that a little bit more. But like everything in medicine, we start something today and we may not know how good it is for many, many years.
Okay. I mean, I've never heard of people doing these injections. it just sounds like it would really hurt.
Well, men will do anything to make their penis bigger.
I'm
and so
understanding that. I'm learning that today.
Well, in all fairness, women do a lot of painful things for the sake of beauty. It's just,
we do, but we have a bigger pain tolerance.
we're just beautifying the penis.
Okay.
So surgical options. So, I want to clarify the penile implant surgery. So penile implant is typically when a man has very advanced erectile dysfunction. Sometimes he may also have Peyronie's disease or the curvature, which we talked about in a previous episode. But if you're looking to just get bigger, that's not a way I would recommend ever going. Because first off, you're removing a natural erection for the rest of your life. Because to put in those pumps internally, you basically core out the erectile chambers. So you're now going to be reliant on that pump for the rest of your life. So if you're some young cat and you're thinking like, oh, I'm just going to go get this surgery, get bigger.
That sounds like a terrible idea.
It is. So I would not recommend that.
I mean, you listed 2 medical issues that would require that kind of a surgery, not something where it's just like, yeah, I wish I was, this was different.
Correct. So just to be clear, penile implant, erectile dysfunction, PD or Peyronie's disease, not going to help you get bigger.
Okay.
Now, there's a surgery that could also theoretically be done to make the hanging length appear bigger. So
do we care about the hanging length?
Every guy does, 100%. Now, do any women? I don't know.
I don't think we do.
Again, this isn't about you. This
okay,
is about
it's not
us
about us, but I'm learning things here about how crazy you guys are.
98% of our self-esteem is right down there.
I understood.
So there's a ligament that really stabilizes the penis when we get an erection. It starts at the pubic bone. So if we think about it, the penis is not an actual bone. It's all soft tissue. So how is it that it stays pretty darn centered in the pubic area during intercourse? Well, there's a ligament from up above that kind of stabilizes it in place. There are some guys who choose to have a surgery to cut that ligament that will then allow the penis to hang down more and give that sort of larger showing appearance rather than the growing.
But doesn't that give a problem to the erection?
Well, that's the key, right?
Why would you sacrifice one for the other?
Well, so it's not going to impact erections, but it's going to impact the stability of the penis during intercourse. So you increase the likelihood of buckling of the penis and a potential injury. So again, I'm going to say no to that.
Sounds like a bad idea.
Now, the one that is actually intriguing, and I did some research before this episode. You can go online and look at this. It's now called Himplant, Himplant. It used to be called the Penuma. It was developed by a surgeon in Beverly Hills. I know that's a shock to everybody. And essentially, it is an implantable kind of a wrap, a silicone wrap that is put in now through a scrotal incision under general anesthesia. And it adds girth and kind of pushes the penis out a little bit. And then you get sutured up and no one knows it's in place. And
it stays in there?
It just stays in there, yeah. And I've got to be honest, I looked at the before and after pictures and they look pretty damn good. Now
they look good.
Yeah, like I was very impressed.
Okay.
Like the fact that the penises still look natural. But the funny thing is,
do they look bigger?
Oh yeah, they looked bigger.
And you said that with great enthusiasm.
Well,
okay.
I did, but here's the funny part. Again, as someone who's looked at a lot of penises and know that the average penis length is probably sitting just under 6 inches, probably 98% of the befores, the guys had a perfectly normal, very satisfactory penis that my guess is most women would look at and be like, oh, that's fine. Now, granted, it was flaccid. Granted, I'm a man who is attracted to women, and so I don't have any experience looking at a penis from that sort of, viewpoint. I'd be curious to get your thoughts, although I think I already know your answers. But it was interesting to know that the before and after pictures, yes, the penis was bigger, but I even look at the before and it's like...
It was fine.
It was fine.
But is this sounds kind of like, I'm curious, it sounds like you're putting a foreign object inside, like a skin stretching mechanism.
It's not necessarily stretching the skin,
painful.
but it's sitting underneath the skin to add that added girth, and just the way it looks. It was interesting because it didn't seem to cover the entire length of the penis, but yet still made it look relatively natural in shape. So
there's no
it's out
way
there.
that is comfortable. That seems very uncomfortable.
Well,
Again, I realize that you people will do anything for this additional length, girth, but wow, that sounds rough.
Well, this brings us as a perfect segue to the most natural and safe way that men, you can grow your penis today, right now. You want to hear it?
Yes, I do. I'm sure most people out there are hanging on to hear this.
All right. So guys,
What?
I'll tune in here.
What do you do?
The best way to grow the length of your penis is to lose weight.
Wait, really?
Yeah. Now,
Why?
for every extra 30 to 50 pounds of weight that you carry as a man,
Okay.
you are essentially losing a complete inch from your penis. Now,
I don't understand.
Here are some caveats. Number one, if you are a normal or average weight, losing 30 to 50 pounds to get to like, what was that movie with Christian Bale where he got like really super thin or something like that?
Oh, I don't know.
I don't know. It was back in the day. I was trying to think of whatever that was, but dude was really thin. You're not going to make your penis bigger. But if you are overweight, you get a deposition of fat in what's called the suprapubic area.
Okay.
So some people call it the fupa. And what happens is the penis gets buried. So a lot of guys come to me and go, can you make it bigger? And what I do is I take as I'm examining them, I take my two hands, I push on either side of their penis, and I go, you want it to look like that? And they go, yeah. I said, well, what you need to do is get rid of all this extra weight. So I know this isn't sexy. It's not something that you were hoping for. I know you all wanted like the pill I've got in my back pocket that's going to give you, again,
There isn't one.
King Dong or whatever title you're looking for. But hands down, the biggest reason that guys feel their penis is smaller is they're just carrying extra weight. And this is honestly the most common presentation in my office. Most guys with normal to average size penises of healthy weight don't come in asking for a bigger penis.
Okay.
99% of the guys that do are fit in this category where they have what's called a buried penis. Now, you can't selectively lose weight. We all know that because for those of us who are like trying to like tone up our belly fat and we're thin elsewhere, it's like you can't just do more abs. And so you can't always, but general weight loss will 100% help. And the other benefit is that often obesity is a risk factor for erectile dysfunction. So all the same diseases that obesity leads to ultimately is going to cause decreased blood flow to the penis, lead to erectile dysfunction. And there is a use it or lose it phenomenon. So I see a lot of guys who have erectile dysfunction and their penis does shrink because it's not getting regular blood flow. So it is actually getting smaller as you put on weight because of those other sequelae. But if you catch it early enough, you lose the weight, you'll get back to where you were beforehand. We're not going to get it again. I can't add 1 to 2 inches by making you so you weigh 100 pounds. But if you are 30 to 50 pounds overweight or more, losing that weight can make a huge difference.
Okay. I didn't really know that. That is very interesting. And I'm sure that's very interesting to a lot of our listeners because that's something you have control over.
Yeah, absolutely. So, Kat, why don't we finish up here? Let's kind of talk about what guys can actually do here and coming in for a consultation. Mm-hmm. So I think the first thing, and we heard it straight from a woman's mouth here, that the size doesn't matter as much as you think it does.
It really doesn't. You guys got to quit watching the porn. It's not a real thing. Nobody lives like that.
Yeah. And listen, are there guys that big? Yes. Are there women or gay men who enjoy penises that big? I'm sure there are. And by all means, enjoy. But what I'm saying to the average guy who's out there, the guy who walks in my office, it's not a big deal. And that you're perfectly fine and healthy.
Perfectly fine.
So I think part 2 is talk to your partner. Like, here is a woman sitting across from me who's telling you guys that, like, it doesn't matter as much as we think it does.
It really doesn't matter.
And so here's what I would love to know. How many of those guys, after they went and had that surgery, went home to their partner and they're like, what the F did you just
do? This thing is crazy. I don't want to work with this thing now.
Yeah. I mean, I can bet a lot of money that there's at least one person who had that surgery and their partner was not at all happy.
I can bet that there was more than one.
Because bigger's not always better. But when should someone see a doctor? You know, if you truly do have a buried penis and you have tried weight loss, there is actually a surgery that can be done to unbury a penis. It's a legitimate medical issue. It can also lead to things like infections. If you can't expose the penis and clean it well, it can lead to urinary trouble. So I don't want to make light of that and just jokingly say, go lose weight and you'll be fine.
No.
There's some guys who legitimately, this is a major issue where they can't expose their penis at all. And so huge quality of life issues there. So there's fellowship trained people often working with plastic surgeons. They can do liposuction in that area, remove the fat surgically. So that can be a big deal. And then otherwise, if you still are a guy who is of average weight and you still feel like you've got some size issues, there are some things that are out there. But first start with talking with your partner, see a board certified urologist.
Talk to your doctor.
And see someone who legitimately sees a lot of penises and can get you that, reassurance in most cases, because most guys don't need these procedures.
You guys are fine. Let it go.
Well, Kat, any final thoughts here as we jump off of
No, I think I have
discussion?
made my feelings known. And I've said what I needed to say today.
So Goldilocks, somewhere in the middle, and most guys are there.
Most everybody's there.
Love it.
And if you're not, you're fine too.
Well, guys, would love to hear your thoughts on this episode. I don't want your penis size in the comments, but hey, tell us what your thoughts are and your experiences with this. Is this something that's ever been a concern for you?
Have you tried any of these crazy methods? And what happened? Are you okay?
Yeah. And if your penis is bigger, just shoot me a DM. I'll give you my email. Just
Please
be private.
do not do that. Thank you.
With that, hit that subscribe button as your final action, please. Hopefully you had some fun today like we did. And please show yourself a little bit more love and kindness and grace. And that includes your penis, because we're all works in progress and your penis is just fine.
It's fine.
Have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit PazonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.